Hi, Dr. Kirk, owner of Nueva, Vida, Quiropracticos, Dorado, Puerto Rico here, and today we're going to talk about a really important subject, and that subject is disc herniations and low back pain. And why would you want to listen to this short video? Well, it's probably the most common condition that presents to our office, but it's also probably one of the most misunderstood conditions. There's a lot of fear associated with low back pain. There's a lot of fear associated with disc herniations. People don't often know why it happens. They don't often know what to do. They certainly don't know how to resolve it and how they should behave. So I thought I'd make this short video to explain some of the recent guidelines which have been produced on low back pain based on the best evidence, throw in a few elements from clinical practice, things I've learned over the last 14 or 15 years of practice, and I sincerely believe that there will be things which will help point you in the right direction. So let's just talk a little bit about low back pain. It's a very general term, and what we typically find is no two cases are the same. Low back pain can occur for any number of reasons. It can be a one-off trauma impact, which can create localized damage, or it can be like a sensitization effect, which comes from repetitive, let's say, insults over a long period of time, and that can start to create sensitivity in and around the joint area and around the muscles, and that can create then a cascading effect in which the person either experiences more and more discomfort, which comes on over time, or more stiffness or rigidity, or they can also be more vulnerable then to a one-off impact or one-off insult, which can then create a major issue, such as a disc herniation or an episode of sciatica. We as doctors typically differentiate between the cause of low back pain, between the actual cause or the source of the problem. So if the problem is being caused by the sciatic nerve or what we call focal disc herniation, something which actually obstructing the nerve, we have a category name for that, and that's probably one of the more severe presentations. We won't get too involved in that here, but in the worst situations of those, and they're very few, those can often lead to surgery. The good news is that that's not a likely occurrence, and it can certainly in most cases be prevented if we take the right steps. So what to do if you're experiencing back pain? Well, number one, you want to make sure first of all that it's not a serious problem, and probably step one is to reassure and encourage everybody that low back pain and discomfort are things which are a normal part of life. Everybody at some point in life is going to experience some pain or discomfort. It's a normal part of living, normal part of being a human being. What is not then normal is for something to start to interrupt your quality of life. That's again, we always talk about your relationship with your partner, at work, with your friends, your sleep patterns, stop you from doing exercise and doing the things you enjoy. That's when I would say that a condition becomes a problem. And that's when it's time, I think, to look for professional help in these sorts of circumstances. So the first thing we try to do with people, first of all, is that we want to listen, we want to understand where they're coming from and why they're being affected so deeply by the issue. Then we want to try to get a more specific diagnosis. So what's actually happening here, and why is the pain level as high as it is? We move beyond that, and then we start to look at well, we go through all the things that you can't do. Perhaps we should focus on things that you can do, because there are many activities and many movements, but we also want to be trying to all the time encourage the person to get back into normal activity and normal routine. And in fact, the people that receive the best results are usually the ones that return to work and return to normal activities as early as possible. So we're always trying to encourage and push people to do that within safe boundaries. Exercise recommendations are extremely important. There's a huge body of evidence that says that back pain resolves and can be helped by exercises. The key is this, is it can't just be any general exercise. Oh, there you go, sir, there's your sheet of exercises for low back pain. They need to be individualized and specific based on patient needs and wants. So there is no the exercise for low back pain. What we have instead is a series of movements, exercise, and activities which will help to strengthen the back up and increase range of motion. It has to be done in a safe way so as not to put the back at further risk. We as chiropractors, we deal predominantly with structure of the body and function. Now, function of the body is dictated and dominated by the activity of the nervous system. If the nervous system is overactive or hyperactive, it can often cause what we call increased tonicity in the muscles, which means the muscles get too stiff or rigid, they don't want to release. And we would typically say that this is a protective response to back pain. Back pain can be scary, the body can see it as something threatening, so the nervous system tightens that area up and decreases range of motion, decreases movement. That's something that we need to work with and work through. So we need to obviously assess that area, then get it moving better and start to try to calm that nervous system down. Once that's happened, we also typically find that muscle activity is changed after an episode of low back pain. And what that will lead to is this statistic is that the most common cause of injury is history of injury in the same place, probably because we don't do a good job of recuperating after the first episode. So my experience is that people typically will quit doing the right things too soon before they have full recovery, because what they really think is, oh, I feel better now, so I don't need to continue with these activities. I'm going to return exactly to what I was doing before I got injured. Work with a lot of athletes, and if I have an athlete who tears a muscle, they don't want to return to how they were just before they tore the muscle. They want to be stronger than before. So I would say the same thing to patients, is you don't want to return to exactly how you were just before you hurt your back. That's not right at all. You need to get back to a situation where your body has more strength and more resilience. That can only be accomplished with exercise, strengthening, and the right type of movement. That typically needs help and advice from a professional. So I would encourage you to reach out and use resources around you. We're very fortunate. We have a lot of good practitioners in this area, and all of them will be able to advise and help you with your journey back to health. That being said, there's also something key here, is that recovery and recuperation is something which cannot be done for you. When a patient brings us a problem as a practitioner, it's still the patient's problem. So we can give advice and we can show the path, the right way to walk. But the patient, the individual, the person with the pain, has to be an active participant in this process. And that's why I often hear people that they want to use gels, they want to use electrotherapy, muscle stimulation, TENS, they want to use ultrasound. And I would really discourage that in first-line treatment for low back pain, because they're all things they're what we call passive. They don't give anything back to the body, and they require another person to do them for us. They don't increase strength, they don't increase movement, they don't really increase resilience. So they're not a long-term solution. It's just another way of possibly taking a painkiller and an analgesic, unless it's done in combination with all the other things which I've mentioned, which is getting the right movement into the body, into the spine, the right stimulation, the right activation for the muscle, and a proper recovery plan. If all those things are in line, the chances are you're going to have a great recovery from your low back pain, from the disc herniation, and from your diagnosis. In very few cases, when the person is, sometimes and most of the time, it's either after severe trauma or when the person has just let things go too far. Obviously surgery is and can be indicated, but as I said, those are very, very few and far between those cases, and we would certainly encourage, and the guidelines certainly encourage people to be more active, more proactive with treatment, and to seek musculoskeletal therapy, exercise therapy, chiropractic therapy, physical therapy as a front line in care of these conditions. So thank you for your attention. If you want to reach out to us, we're based in Dorado. We're certainly happy to answer and work with any questions or any inquiries you have. If you're not based in around the Dorado area, please feel free to reach out. We can certainly connect you with the right people in your area. And again, thanks for your attention, and I'd just like to wish you have a happy and active day.